Hi everyone, and welcome back to the GuideWell Insights Lounge. We're here at day 3 of Singularity University's Exponential Medicine. Welcome everyone, my name is Kate Warnock and I'm so pleased to bring a very distinguished guest, Dr. Arshya Vahabzadeh. Welcome to the interview, Arshya.
Thank you so much, Kate. Pleasure.
Arshya is Site Director and the Director of Digital Health at Brain Power LLC. Arshya, you were on the main stage today. Congratulations being a speaker here at Exponential Medicine. You were talking about the future of brain and neuromedicine. Can you recap the top points for us?
Absolutely, Kate. Thank you so much. So I'm a psychiatrist and I'm very interested in mental health and especially the intersection of technology and mental health. My main points are that we have a tremendous need for mental health services in this country. At the moment, we simply do not have the human manpower in terms of physicians and other clinicians to deliver that. So advances in technology are going to herald dramatic new opportunities in terms of research, in terms of clinical care, and in terms of population wellness that we can utilize to enhance mental health care in this country. And I think mental health care is extremely important because it's one of the biggest causes of disability, both nationally and across the world. And 1 in 5 Americans has a mental health condition in any given year. So it's an utmost priority that we explore all the avenues we can.
You know, Arshya, in the role that you have, why is it that you think that mental health really hasn't been given the due that it's, or it doesn't have the resources that it deserves when, as you say, so many people are impacted by mental health issues and it's a leading driver. We even had a speaker on earlier who was saying that it's responsible for so many trips to the emergency room. Why does mental health continue to be a healthcare disparity?
Thank you. I think that mental health and physical health have often been in different silos in our healthcare system, really inappropriately so. But I think some of those silos are actually being broken down now. When we think about mental health, there's actually a lot of strong links between physical illness. And many of our behavioral and mental health issues are driving some of our largest costs in chronic health conditions, such as diabetes, such as heart disease, for example. So we really need to change how we fund mental health, how much services we give to our patients, because ultimately it's a very integral part of medicine and our healthcare systems.
You know, Arshya, we had Corey Lathan on earlier at the GuideWell Insights Lounge, and she was describing to us how really testing for brain health in itself isn't as advanced as we would want it to be. How is it that you see kind of moving the needle so that brain health does become an integral part of just primary care?
Absolutely. I think it's very critical that we involve primary care. I think it can be a very useful cornerstone in terms of our healthcare interventions. What we need to do is to ensure that the patients that need mental health treatment are diagnosed and identified at an early stage,
Sure.
A triage service, and put into different categories depending on their healthcare needs. Part of that is going to be done through the use of innovative technologies, through the use of smartphones and other sensors that are going to be able to predict deteriorations in our patients' mental health so we can intervene early and get them the right care when they need it.
You know, so again, you have so many roles, and I think that we're fortunate to have you in the positions you play. You are also the Innovation Officer for Massachusetts General Hospital. How do you introduce new concepts in a way that can be implemented in the short term, and how do you pace yourself for innovations with a longer time before an ROI?
Okay, thank you. So part of the work I do at Mass General with the Psychiatry Academy is to help to come up with ways to teach and educate clinicians and psychiatrists about the new innovations in mental health. And there are so many innovations happening, but it's often difficult for clinicians to keep up to speed with them and understand what the research base is behind many of these interventions. But I think it's critical for us to appreciate that the consumer space is rapidly moving along. A lot of consumers are getting a lot of these technologies in their hands, and they want their clinicians to at least have some awareness of what's happening. As you may know, innovation is a process, and part of that is refining the process of developing innovation, talking to colleagues, and making sure that we can introduce new ideas and concepts in a way that's useful for our patients, but also safe and keeps our patients healthy.
Right, right. Well, Arshya, as far as you're working directly with mental health, the mental health practitioners of today and tomorrow, and the fact that you're working with your students, how is it that you're training them to work better and more seamlessly with what we're calling the empowered consumer, but really where we expect medicine going, and that it's going to be more collaborative? This is a really different paradigm, isn't it? So how do you address that with your students?
I am an incredible advocate of collaboratively working through healthcare problems with patients or consumers, because consumers are only patients when they're in a hospital setting.
Right.
And I think it's particularly important for mental health, because a lot of the challenges that the consumers or patients face are due to communication difficulties, feel that they're not getting value out of the services that they are offered. So I think that having a good, empathetic way of communicating with our patients, being available for our patients, the human touch is actually very important in mental health, and I don't feel that technology can totally replace that.
Sure.
And as I tell the students, you should really deeply understand the whole person behind the patients that you see. There's a lot of intersections between medicine, the educational system, the social system, and sometimes just going into a patient's home gives you a perspective as to why they won't necessarily follow your exercise regime if their neighborhood isn't safe,
right.
Why they wouldn't follow the diet you recommend if the cheapest source of food is a fast food restaurant,
right.
And the cost differential is tenfold. So really fundamentally knowing your patients and understanding their story is actually incredibly powerful to optimizing healthcare outcomes.
So Arshya, you've touched on a theme that's been so widely discussed here, and that's social determinants of health, and really what that gets just down to is the human side of medicine, and the fact that, as you say, the best technology will never overcome someone who lives in perhaps a dangerous situation or just doesn't even have the education level to be able to comply with the directions that they're given. So, I look forward to hearing more about what you do in this space. I think that you're obviously such an innovator and in such a critical role. Thank you for joining us here
at
the Guidewell Insights Lounge. Enjoy the rest of the conference. My name is Kate Warnock. We'll be up next with another interview in just a moment.